welcome back! I'm Dr. Dustin Portela, a board-certified dermatologist, and today we're diving into one of the trickiest topics in skincare, blackhead removal for sensitive skin. If your skin tends to turn red, sting, or get inflamed after extractions, this video is definitely for you. Now, a lot of what we see online are extreme extractions, aggressive squeezing, metal tools, or strong acids that promise instant results. But for sensitive skin, those quick fixes can actually lead to barrier damage, broken capillaries, and long-term irritation. The truth is, sensitive skin needs a gentler, more mindful approach. You can absolutely remove blackheads safely. It just requires the right techniques, the right timing, and the right products. In today's video, we'll break down dermatologist-approved methods to extract blackheads without causing trauma. I'll walk you through the safest professional tools, explain which ingredients to avoid if your skin easily reacts, and show you how to calm and protect your skin afterward. We'll also discuss what actually causes irritation during extractions, from friction and pressure to product misuse, so you'll know exactly how to avoid it next time. And if you're serious about building a barrier-friendly routine, I'll be highlighting a few gentle cleansers and non-comedogenic moisturizers from my own skincare line that support skin recovery and keep your pores clear without over-drying. We're keeping things real, educational, and skin-safe today. So whether you're a skincare enthusiast or just tired of post-extraction redness, stay tuned. Do you have sensitive skin? Comment below and tell me how your skin reacts after extractions. I'd love to hear your experience. Oof, we've all seen that post-extraction glow that isn't exactly glowing. Watching this clip, you can see the skin looking pink, inflamed, maybe even shiny in a not-so-happy way. That's the kind of reaction I see all the time when sensitive skin gets pushed past its limits. As a dermatologist, I can tell you this isn't about someone doing something wrong. It's about skin that's already on high alert. Sensitive skin is like that one friend who's polite until you poke them one too many times, and then suddenly they're done. So what actually makes skin sensitive? It all comes down to a compromised barrier. Think of your skin barrier as a brick wall made of skin cells and lipids. When it's strong, it keeps moisture in and irritants out. But when it's weakened by harsh cleansers, over-exfoliation, or rough extractions, the mortar between those cells breaks down. Now, everyday things like friction, heat, or certain ingredients can sneak in and cause a reaction. Beneath that barrier are thousands of nerve endings just waiting to signal, hey, something's wrong. That's when you feel stinging, burning, or see redness spreading across your cheeks or nose. And you can really see that in this video. Those red patches after extractions, that's your skin's inflammatory response. It's literally sending SOS signals. The pressure used during squeezing can rupture tiny vessels or stretch pores beyond their limit. Even metal extraction tools, if not sanitized or used with the right technique, can scrape the surface and trigger irritation. It's not the blackhead's fault. It's that the skin's defenses weren't ready for battle. Another common trigger is the use of strong exfoliants right before or after an extraction. I've had patients tell me they used a salicylic acid toner, then a scrub, then went in with an extractor, all in the same routine. That's like exfoliating your skin 3 times and then asking it to smile for the camera. Sensitive skin can't keep up with that pace. Even products that are perfectly fine for someone with oily or resilient skin can be too stimulating for a compromised barrier. Here's what sensitivity really looks like in practice: that tight, dry feeling after cleansing, a burning sensation when applying moisturizer, blotchy redness around the nose or chin, sometimes even flaking or swelling. And it's not just about discomfort. Over time, chronic inflammation can actually make skin age faster, slow down healing, and disrupt its ability to regulate oil and hydration. So what can we do about it? The first step is always protection, and that means respecting your barrier. Keep your skincare simple and supportive: a gentle, pH-balanced cleanser that doesn't strip the skin, a fragrance-free moisturizer that replenishes ceramides and lipids, and sunscreen every single day. If you're doing extractions at home, make sure your skin is prepped with steam or a warm compress to soften the pores. And always follow up with something soothing. Think aloe, niacinamide, or panthenol. Hydration is another key piece people often overlook. When your skin is dehydrated, the barrier becomes brittle, kind of like a dry sponge that cracks instead of flexing. Using hydrating toners or serums with hyaluronic acid and glycerin can help the skin hold on to moisture, which in turn strengthens its natural defenses. And yes, even oily or acne-prone skin can be dehydrated. The goal isn't to dry it out, it's to keep it balanced. And if your skin's yelling at you, it's time to listen. That burning, stinging, or flushing sensation is your body's way of saying, hey, something's not right. Instead of pushing through with more products, take a step back. Sometimes the best skincare move is to just do less, Give your skin a few days off from actives. Focus on barrier repair and let it breathe if you're prone to post-extraction irritation. You might also want to look for products labeled barrier repair or recovery. Ingredients like ceramides, squalane, and colloidal oatmeal can calm inflammation while rebuilding that protective wall. And don't underestimate the role of temperature. Even washing your face with hot water can make sensitive skin flare up, so stick to lukewarm water and gentle pat drying. At the end of the day, sensitive skin isn't a flaw. It's just more communicative. It tells you quickly when something's off. The trick is to listen and respond with care instead of force. With the right techniques in some patients, you can absolutely keep your pores clean and your barrier happy. What about you? What's your biggest struggle with sensitive skin redness or dryness? Okay, I have to pause right here because watching this clip, I can already feel my own skin tightening in sympathy. This person's going straight in with extraction, skipping all the prep steps, and then pressing a steaming hot towel right on the face. So you can see it, the skin instantly flushes, and that's not a healthy glow. That's inflammation setting in. Sensitive skin especially does not appreciate sudden temperature spikes or rough handling. It's like walking out of an air-conditioned room into a desert wind. Your skin just freaks out. Prepping the skin before extractions isn't optional, it's essential. Think of it as a warm-up before a workout. You wouldn't sprint cold, and your pores shouldn't either. The goal is to make the extraction as easy and trauma-free as possible by softening the skin and loosening the debris inside the pores. And you can absolutely do that safely without boiling your face or stripping your barrier. Here's where people go wrong. They use water that's way too hot, hold steam too close, or slap on a towel that could practically cook noodles. While heat does help open pores slightly, excessive heat breaks down capillaries and triggers redness, especially in those with rosacea-prone or reactive skin. So here's the myth-busting moment. You don't need to burn your skin with steam to get blackheads out. In fact, for sensitive skin, mild warmth is plenty. A safe approach starts with a gentle cleanse. Choose a fragrance-free, sulfate-free cleanser to remove dirt, sunscreen, or makeup. This gives you a clean surface without disrupting your natural oils. Next, instead of blasting your face with hot steam, go for a lukewarm compress. You can use a soft washcloth soaked in warm, not hot water, then press it gently on your skin for about 2 to 3 minutes. The warmth helps soften the sebum and relax the pores without causing inflammation. You'll know it's the right temperature if it feels comforting, not like a sauna session. If you prefer steam, keep your face at least 10-12 inches away from the source and limit it to no more than 5 minutes. Steam should feel soothing, never prickly or intense. You're helping your skin breathe, not a bowl, and afterward, pat gently, don't rub because the skin is now more permeable and vulnerable to irritation. Another great step for prepping sensitive skin is using a hydrating toner or essence before extraction. Look for ingredients like glycerin, panthenol, or hyaluronic acid. These don't just hydrate, they help maintain your skin's elasticity so it's more resilient during the extraction process. Think of it as giving your skin a little cushion. A hydrated barrier responds better to pressure and heals faster. For my patients who want to be extra cautious, I also recommend applying a light layer of a calming serum with ingredients like niacinamide or Centella asiatica before starting. It reduces reactivity and provides some anti-inflammatory support right from the start. This is especially helpful if your skin tends to sting easily or if you've had redness flare-ups after treatments in the past. And here's another underrated tip. Keep your environment in mind. If you're doing extractions in a hot bathroom with no ventilation, your skin's temperature can rise even faster. Try to stay in a cool, lit space where you can control how warm things get. Sensitive skin thrives in balance, not extremes. Now let's talk tools for a second. If you're using extraction tools, make sure they're sanitized. Always a simple wipe with alcohol or washing them in warm, soapy water before and after use can save you a lot of irritation later. Bacteria are not your friends during this process, and if you're using your fingers, wrap them with clean tissue or cotton pads to create a soft barrier that minimizes friction and tearing. You'll notice in the video we're reacting to that skipping these prep steps almost guarantees irritation afterward. The pores weren't softened, the skin wasn't hydrated, and the towel was way too hot, so instead of clean, calm skin, you get redness and micro swelling. It's one of those could have been avoided moments I see way too often. Here's the thing, prepping sensitive skin doesn't take long, but it makes all the difference. You're essentially setting your skin up for success. When your barrier is hydrated, your pores are relaxed, and your skin is calm, extractions can be done gently and effectively. Skip those steps and your skin will let you know immediately, usually in the form of redness, tenderness, or that post-extraction sting. So the next time you're tempted to dive right in, take a minute, cleanse, hydrate, and warm up your skin gently. Your barrier will thank you, TikTok, and you'll get cleaner results with far less irritation. Remember, the goal isn't to fight your skin, it's to work with it. Now I'm curious, do you prep your skin before extractions, or are you guilty of diving right in? Now this is what I like to see. Watching this viral clip, you can tell the person knows what they're doing. The pressure is gentle, the movements are controlled, and the skin isn't being punished into submission. For those of us with sensitive skin, TikTok, this kind of careful technique is the gold standard. It's not about brute force, it's about finesse. When extractions are done right, you should see a blackhead ease out. Not a red patch bloom across the face. One of the biggest mistakes people make during extractions is using too much pressure. It's tempting, I know. You see that stubborn blackhead and think, just a little harder. But here's what happens when you over-squeeze. You're not only forcing out the clog, you're pushing pressure into the surrounding tissue. That trauma can break tiny capillaries beneath the skin, leading to those little red veins or blotchy marks that stick around long after the blackhead is gone. Sensitive skin especially doesn't bounce back quickly from that kind of stress. What looks like a quick fix turns into lingering irritation or even scarring. In this video, you can see the extractor being used with precision. That small loop is positioned just right at an angle that applies even light pressure around the blackhead, not directly on top of it. That's exactly how you should use a Comedone extractor. The loop should hug the pore gently, and the pressure should feel more like a soft roll than a squeeze. If nothing comes out after a couple of seconds, stop. Don't dig, don't press harder. That blackhead isn't ready, and forcing it can cause an injury. Sensitive skin responds best to patience, not persistence. If you're doing extractions at home, I recommend 3 safe tools: a sterilized Comedone extractor, 2 cotton swabs, or clean, gloved fingers wrapped in tissue. Cotton swabs are actually fantastic for people with reactive skin. They distribute pressure more evenly and prevent nails from scratching or tearing the surface. Plus, they give you a little buffer that reduces friction. If you're using fingers, keep your nails short, use tissues as a cushion, and press from the sides of the blackhead, not directly down. The goal is to lift the debris out, not crush it deeper in. And hygiene, please don't skip it. Whether you're using tools or fingers, everything should be clean. Wash your hands thoroughly, disinfect your extractor with rubbing alcohol, and work in a clean, well-lit area. Sensitive skin already struggles with inflammation. Introducing bacteria only makes things worse. You want your pores to be clear, not infected. Another thing I appreciate in this video is how they pause between extractions. That's so important. Give the skin time to breathe. Sensitive skin flushes easily, and you can see the difference between mild pinkness, which is temporary, and angry redness, which signals damage. If the skin looks shiny or feels tender, that's your cue to stop. Extraction is not an endurance test. It's a balance between effectiveness and respect for your skin's limits. A common myth I hear is that you need to extract every single blackhead in one session. Nope. That's like trying to deep clean your entire house in 1 hour. It's exhausting and unnecessary. For sensitive skin, slow and steady truly wins the race. Focus on a few congested areas, like the nose or chin, and leave the rest for another day. Overworking the skin can compromise its barrier and cause post-extraction breakouts. And let's talk humor for a second, because I know some of you are out there treating your face like a contact sport. Your goal is clean pores, not a wrestling match with your skin. The gentler you are, the better your results will look. There's nothing satisfying about a red, swollen patch where a calm, clear pore should be. If you find yourself constantly dealing with irritation, it might be time to see a professional. Dermatologists and licensed aestheticians have the training and sterile environment to do extractions safely. In our clinics, we use magnification, proper lighting, and tools that minimize trauma. We can also assess whether a bump is a true blackhead or something deeper like a closed Comedone or milia, which shouldn't be extracted manually at all. I also want to emphasize the aftercare side. Once you've done your extractions, resist the urge to poke around again. Apply a soothing product, something with a low centella, or a light barrier repair cream, and avoid makeup or harsh products for at least 24 hours. Sensitive skin needs downtime to heal and reset. So, watching this gentle technique in the video, you can really see the difference good habits make. It's calm, controlled, and respectful to the skin, exactly how extractions should be done. It's a perfect reminder that skill beats force every time. Now I'm curious, have you ever tried professional extractions? Was it worth it for your sensitive skin? Oh no, this is the kind of clip that makes every dermatologist flinch. You can see right away that the person in the video is jumping straight into extractions with bare hands and no prep. No gloves, no tool sanitizing, not even a quick hand wash. I can already see the bacteria forming an after party. It might look like a simple DIY routine, but what's really happening is a perfect setup for irritation, redness, and even infection. Talk, especially if you've got sensitive skin. Let's talk about why hygiene is non-negotiable when it comes to extractions. Talk, your skin's barrier is already a little more vulnerable after steaming or softening the pores. The last thing it needs is bacteria from your hands, nails, talk, or tools entering those freshly opened pores. When your skin is sensitive, even a minor contamination can trigger an inflammatory response. Think redness, swelling, tick-tock, and little pustules that weren't there before. And trust me, post-extraction breakouts are way more frustrating than the blackheads you started with. Here's the thing, talk. Sensitive skin is like a sponge for irritation. Any small injury like squeezing or scratching creates micro tears. Those tiny openings are prime entry points for bacteria. Talk, add in unclean tools or fingers and suddenly your quick extraction turns into a week of burning, flaking, or breakouts. You might even see those small, painful white bumps that pop up a day or two later. Those are often caused by bacteria your skin didn't appreciate meeting. That's why step one is always clean hands. Before you even think about touching your face, wash your hands thoroughly with soap and warm water for at least 20 seconds. Sounds simple, but it's one of the most effective ways to prevent irritation and infection. Next, if you're using extraction tools like Comdone extractors, tweezers, or even scissors for skincare prep, they need to be sanitized every single time. The easiest way, wipe them down with isopropyl alcohol 70% or higher before and after use. Let them air dry completely before touching your skin. If you prefer a more old school route, you can soak your tools in boiling water for a few minutes. Then let them cool and dry on a clean paper towel. Just remember, clean doesn't mean safe. Tools can look spotless but still harbor bacteria or residue. Sensitive skin doesn't have much tolerance for even trace irritants, so it's worth being meticulous. In the video, you can see the person using bare fingers, and that's another big no for anyone with reactive skin. Our hands carry natural oils, dirt, and bacteria, even if they look clean. Instead, wrap your fingers with clean tissue or wear disposable gloves. Gloves aren't just for professionals, they create a barrier that prevents contamination and gives you a better grip without digging into the skin. If you've ever noticed that your skin gets redder when using bare hands, it's likely from that added friction and oil transfer. Here's a pro tip before starting extractions. Wipe your skin gently with an alcohol-free antiseptic toner or micellar water to remove surface bacteria. This gives you a clean working area without stripping moisture. After extractions, do a second cleanse, gently, not aggressively. This helps remove any remaining debris or oils that surface during the process. Avoid strong cleansers, exfoliants, or acids immediately afterward. Your skin is in healing mode, not exfoliating mode. Let's also talk about tool handling. Never reuse dirty tissues or cotton pads between extractions. Once you've touched one area of your face, toss it. Cross-contamination is real. If you pop one blackhead, wipe away the residue immediately with a clean pad soaked in an antiseptic toner or even saline solution. This minimizes the spread of bacteria to nearby pores. It's a small habit that makes a huge difference, especially for sensitive, redness-prone skin. And please never use sharp household objects like pens, needles, or tweezers that aren't made for skincare. I've seen patients try to gently help a clogged pore with a sewing needle, and the result is always the same: an inflamed wound, post-inflammatory hyperpigmentation, and a damaged barrier. Professional Comdone extractors are designed with rounded edges for a reason. They apply even pressure without cutting or tearing. When it comes to hygiene, prevention really is the best cure. Keeping your tools and clean doesn't just stop infections, it also reduces inflammation, redness, and the risk of post-extraction breakouts. You'll actually see a smoother, calmer result when hygiene is prioritized. And as an added bonus, your skincare products will absorb better because your pores are clear, not inflamed or swollen. I always tell my patients you can't have healthy skin without clean habits. Even if your technique is perfect, skipping sanitation cancels out all your effort. Sensitive skin demands extra care, and hygiene is one of the simplest, most effective ways to show that care. So the next time you're tempted to grab that extractor or squeeze a blackhead, take 30 seconds to clean up first. Your skin will thank you later. Be honest. How often do you actually clean your extraction tools? Ouch, you can see it right away in this clip. The skin looks flushed, shiny, maybe even a little flaky around the nose and cheeks. That's classic post-extraction irritation, especially on sensitive skin. It's that combination of redness and tightness that makes you think, did I do something wrong? But don't worry, this kind of reaction is common when your barrier's been pushed too hard, and the good news is, you can absolutely calm it down with the right aftercare. After extractions, your skin's top layer is more vulnerable than usual. Pores are open, the barrier is slightly disrupted, and your natural oils might have been stripped away during cleansing or pressure. Sensitive skin reacts quickly to that disruption with redness, warmth, or stinging. Basically, Talk, your body's way of saying, hey, I need a little TLC right now. That's why post-extraction care isn't an optional step, it's half the treatment. Talk, the first thing your skin needs is cooling, not cold, but soothing. A clean, cool compress works wonders. Talk, you can use a soft cotton pad soaked in cool, not icy water, or even a calming thermal spring mist to bring down inflammation. TikTok, it's amazing how just 2 or 3 minutes of gentle cooling can reduce redness and help your skin feel comfortable again. Talk, avoid using ice directly on the skin. It might feel good for a second, but extreme cold can cause broken capillaries and more sensitivity over time. Once you've cooled the skin, it's time to focus on calming ingredients. Niacinamide is one of my top recommendations. It helps strengthen the skin barrier, reduce redness, and support healing. Another fantastic option is panthenol as a vitamin B5, which hydrates while soothing irritation. Look for lightweight, fragrance-free moisturizers that include ceramide, squalane, or Centella asiatica. These ingredients mimic your skin's natural lipids and help seal in moisture without clogging pores. In this video, you can see the person reaching for a toner that likely contains alcohol, and that's a big no for sensitive, freshly treated skin. Alcohol-based products might give that satisfying, clean feeling, but they strip away what little moisture is left and sting like crazy on compromised skin. The same goes for exfoliating acids like glycolic or salicylic acid. They're fantastic on normal days, but post-extraction they're too harsh. Your skin doesn't need exfoliation right now, it needs recovery. Think of your barrier as a protective blanket. When it's healthy, it keeps the good stuff, hydration in, and the bad stuff of bacteria and irritants out. After extractions, that blanket has a few small tears, and if you pile on strong actives or fragrance products, it's like rubbing salt into a paper cut. The goal is to patch that blanket gently with barrier, repairing ingredients until your skin feels calm, soft, and balanced again. Here's what a dermatologist-approved post-extraction routine might look like. Start with a gentle rinse using cool water and a mild, non-foaming cleanser to remove any residue. Pat your skin dry with a soft towel, never rub. Apply a soothing mist or compress to bring down any lingering heat, then follow with a calming serum containing niacinamide or centella. Finally, lock it all in with a fragrance-free moisturizer rich in ceramides. If your skin feels tight or warm, you can even keep your moisturizer in the fridge for an extra cooling effect. Just make sure it's clean and sealed. Another tip I often give my patients is to avoid makeup and heavy sunscreens for at least 24 hours after extractions. Give your skin time to breathe, heal if you need to go outside. Opt for a lightweight, mineral-based sunscreen with zinc oxide. It's gentler and offers anti-inflammatory benefits. Avoid chemical filters for a day or two. They can sting sensitive, freshly treated skin. Hydration is also key in the days following extractions. Drink plenty of water and keep your skincare routine simple. Cleanser, moisturizer, sunscreen, and maybe one calming serum. That's it. Overloading your skin with actives like retinol, AHAs, or vitamin C will only prolong the redness. The simpler your routine, the faster your skin will recover. And if you ever notice peeling or flaking, don't exfoliate it away. That's your skin naturally renewing itself. Let it shed gently and focus on moisturizing more often. Products containing oat extract or aloe vera can provide extra comfort without irritation. The main takeaway, post-extraction care is all about balance, calm, hydrate, protect. Think of it as tucking your skin into bed after a long day. It's worked hard, it's a little sensitive, and it just needs to be treated kindly. With the right approach, that temporary redness fades quickly and what's left behind is healthy, smooth, and radiant skin that feels as good as it looks. So if you've ever finished an extraction session and thought, why does my skin look angry? Remember, the fix isn't complicated. Gentle, hydrating, and fragrance-free is the way to go. Skip the harsh stuff and your skin will reward you with that calm, even-toned glow we're all after. What's your go-to soothing product after extractions? Now, this is the kind of transformation we love to see. Watching this clip, the skin looks calm, smooth, and clear. No redness, no inflammation, just that healthy, balanced glow that sensitive skin can absolutely achieve with the right care. You can tell this person took their time, followed the right steps, and gave their skin what it needed instead of forcing it into submission. That's really the secret. Clear skin isn't about force, it's about consistency and kindness. When you're dealing with sensitive, blackhead-prone skin, the goal isn't to fight your pores, it's to support them. A strong, steady routine will always outperform quick fixes. It's not dramatic, but it works, and it keeps working long-term. Let's break down what that looks like. It all starts with cleansing. For sensitive skin, less is more. A gentle, pH-balanced cleanser used twice daily helps remove dirt, sunscreen, and excess oil without disrupting the barrier. Foaming cleansers can be too harsh, so I recommend a gel or cream formula with soothing ingredients like glycerin or oat extract. Massage it in with light, circular motions for about 30 seconds. Then rinse with lukewarm water, not hot. Hot water may feel luxurious, but it strips away essential lipids and weakens the barrier over time. Next comes exfoliation, and this is where most people overdo it. Sensitive skin still needs exfoliation to keep pores clear, but it should be gentle and consistent, not aggressive. Instead of strong acids like glycolic, look for polyhydroxy acids, PHAs or lactic acid. PHAs work like a slow, steady broom for your pores. Clearing out dead skin cells while drawing in hydration. Lactic acid is also a great option. It's mild, supports the moisture barrier, and helps fade post-extraction redness over time. Using these once or twice a week is plenty. Hydration, of course, is the backbone of every sensitive skin routine. When your skin is hydrated, it's resilient. When it's dry, it's reactive. Think of hydration as armor. It strengthens the barrier so you can handle environmental stress without flaring up. A fragrance-free moisturizer with ceramides, niacinamide, squalane is perfect for daily use. These ingredients mimic what your skin naturally produces, reinforcing its structure and soothing microinflammation. For a lightweight feel, try a gel cream texture in the morning and a richer cream at night. Now let's talk about one of the most overlooked steps, sunscreen. Sunscreen isn't just about preventing sunburn, it's about protecting your barrier from UV-induced inflammation and long-term damage. Sensitive skin is particularly prone to redness and pigmentation when exposed to sunlight, especially after extractions or exfoliation. A mineral sunscreen with zinc oxide or titanium dioxide offers broad-spectrum protection without the sting. It also creates a gentle physical shield that calms irritation while blocking UV rays. If you've ever found sunscreen uncomfortable, that's likely from chemical filters. Switching to mineral formulas can be a game changer. Balancing oil control is another big one. Many people with blackheads assume they need to strip away oil completely, but that actually backfires. When your skin is deprived of moisture, it compensates by producing even more oil, leading to clogged pores and breakouts. The key is to regulate oil, not eliminate it. Use a lightweight, non-comedogenic moisturizer that hydrates without suffocating your pores. Ingredients like niacinamide and green tea extract can help balance sebum production while calming redness. And remember, consistency beats intensity every single time. Gentle daily care builds stronger skin over the long term. You don't need to change products every week or overload your routine with actives. Stick with what works and give it time. Most barrier repairing products need at least 4 to 6 weeks to show real progress, especially if your skin has been sensitized. I often recommend a few dermatologist-approved brands for sensitive skin routines. Look for lines like CeraVe, La Roche-Posay, or Vanicream. Their products are formulated with minimal fragrance and clinically tested for reactivity, which makes them great choices for maintaining calm, clear skin. If you prefer something with active ingredients, start slow, patch test first, and introduce one product at a time. Watching this smooth post-care transformation, you can really see how patience pays off. There's no redness, no dry flakes, just balanced, hydrated skin. That's the result of small, consistent choices. Gentle cleansing, a regular hydration, smart exfoliation, and daily SPF. It's not magic, it's method. The most important thing to remember, your skin isn't your enemy, it's communicating with you. When you listen, by being consistent, gentle, and patient, it responds beautifully. The calmness you see here isn't just surface level it's the result of a stable barrier that feels safe again. That's the kind of progress we love to see, especially for those who've struggled with sensitivity and inflammation. If you've been on the fence about simplifying your skincare or slowing down your exfoliation, take this as your sign. Sustainable skincare means supporting your skin's rhythm, not fighting against it. With time, you'll find that your pores stay cleaner, your texture smooths out, and your overall tone looks more even, all without the irritation cycle. Would you like a sensitive skin routine breakdown in my next video? Drop a yes below.